If you've ever looked in the mirror and noticed small white or yellowish lumps sitting at the back of your throat, you're not alone. And if you've ever squeezed them out, felt relief for a day or two, only for them to come back again, that cycle can feel frustrating, even a little disturbing. These are called tonsil stones, or medically, tonsilloliths. And while they often seem harmless at first, many people slowly start to worry, not just because of bad breath, but because they keep returning no matter what you do. Here's the uncomfortable truth most people don't realize early on. Tonsil stones are not a random problem. They are usually a sign that your tonsils have developed small crevices, or crypts, where debris gets trapped over time. Food particles, dead cells, and bacteria slowly build up in these spaces and harden. That's why you can remove them today, and see them again next week. And this is where most people get stuck in the wrong cycle. They try mouthwash after mouthwash. They scrape. They gargle aggressively. Some even start thinking about surgery just to end it once and for all. But the real question is not just how do you remove tonsil stones. The real question is, why do they keep forming in the first place? Because until you understand that, you're only treating what you can see, not what's actually causing the repetition. In today's video, we're going to break this down in a very simple, evidence-based way. No fear. No exaggerated claims. No miracle cures. Just clear medical understanding. What tonsil stones really are. Why they form again and again in some people. When they are harmless, and when they need attention. And most importantly, what actually helps reduce their recurrence without rushing into surgery. We'll also talk about a common misunderstanding, that surgery is always the final solution. In reality, tonsil removal is usually reserved for specific cases, not mild or occasional stones. Because your tonsils are not useless tissue. They are part of your immune system's first line of defense. And like any system in the body, the goal is not to remove parts blindly, but to understand why they are struggling in the first place. So before you think about cutting anything out, or trying random home remedies you found online, let's first understand what's really going on inside your throat. To understand tonsil stones properly, we first need to look at what your tonsils actually are doing every day. Your tonsils are small lymphoid tissues located at the back of your throat. Think of them as part of your immune system's front security team. Every time you breathe in air, swallow food, or drink water, your tonsils are exposed to bacteria, dust particles, and other microbes. To protect you, the surface of the tonsils is not smooth. Instead, it contains tiny folds and pockets called crypts. These crypts are completely normal. In fact, they help trap and detect harmful microbes so your immune system can respond early. The problem starts when these pockets become too deep or too easily clogged. Over time, small particles can get trapped inside them, things like dead skin cells, food debris, mucus, and bacteria from your mouth. Instead of being cleared out, this material starts to accumulate layer by layer. Gradually, it hardens. This is what we call a tonsil stone. Now here's an important point most people miss. Tonsil stones are not a sign of dirty throat or poor hygiene in most cases. Many people who brush, floss, and rinse regularly still get them. That's because the issue is not just cleanliness, it's also the structure of the tonsils and how easily those crypts trap material. Some people naturally have deeper crypts than others. That alone can make them more prone to recurring stones. But structure is only one part of the story. Several everyday factors can increase the chances of tonsil stones forming, including chronic postnasal drip, mucus dripping from the nose into the throat. Dry mouth, especially during sleep. Mouth breathing instead of nasal breathing. Poor hydration. Recurrent throat infections or inflammation. High bacterial load in the mouth due to dental issues. When these factors combine, the environment in the throat becomes more sticky, meaning debris is more likely to stay trapped instead of being naturally cleared away by saliva and swallowing. This is why some people only get tonsil stones occasionally, while others struggle with them again and again. And this also explains why simple removal often doesn't solve the problem long term. Because you're clearing the result, not changing the conditions that caused it. In the next section, we'll look at a very important question. When should you actually worry about tonsil stones, and when are they mostly just a harmless but annoying condition? Now that you understand what tonsil stones are and why they form, the next important question is, when should you actually worry about them? Because here's something reassuring: in most people, tonsil stones are more of an annoyance than a serious medical threat. Small, occasional stones that come out easily, don't cause pain, and only lead to mild bad breath are usually considered benign. They may be uncomfortable socially, but they are not typically dangerous on their own. However, the situation changes when tonsil stones become frequent, large, or associated with ongoing inflammation. There are a few warning signs you should pay attention to. If you experience persistent sore throat, especially on one side. If your tonsils appear consistently swollen or red. If you notice difficulty swallowing or a feeling of something stuck in the throat. If there is frequent bad breath that doesn't improve with oral hygiene. Or if you are getting repeated episodes of tonsillitis or fever. These signs suggest that the tonsils are not just forming stones, they may be dealing with ongoing chronic inflammation. And chronic inflammation is the real issue doctors pay attention to. Because when the tonsils stay inflamed for long periods, their tissue can become more irregular, which actually creates even more pockets for debris to collect. This becomes a cycle. Inflammation leads to more crypts, and more crypts lead to more stones. This is also where people start thinking about surgery, tonsillectomy. But medically speaking, surgery is not the first step in most cases. It is usually reserved for situations like severe, recurrent tonsillitis that affects quality of life, frequent infections requiring repeated antibiotics, significant obstruction affecting breathing or swallowing, or complications where the tonsils are clearly causing more harm than protection. For mild to moderate tonsil stone problems, doctors usually focus first on conservative management, such as improving oral hygiene, addressing nasal or sinus issues, and reducing chronic irritation in the throat. Because removing the tonsils is not a small decision, it permanently removes part of your immune defense system at the entrance of your airway. That's why understanding the root cause matters so much. If we only treat the stones without addressing why the throat environment is allowing them to form, the problem often keeps coming back in different ways. In the next section, we'll break down what actually helps reduce tonsil stone formation in a practical, safe, and medically reasonable way, without jumping straight to surgery or extreme treatments.